Meeting is now being recorded, but if you do have questions, please feel free to type in and ask them. Happy to address any questions that you have. As I was mentioning to Jane, Melissa, this is not a picture you need to know, and anyone who's listening later, I just put it up as an introduction to what we're going to be talking about this week and next, and that's the circulation portion of the cardiovascular system. We're going to delve a little bit more into functional and anatomical characteristics of the blood vessels themselves, as well as fluid dynamics, which is actually a function of engineering and physics. So you get such a well-rounded education in anatomy and physiology. But we're going to just break it down to the important points of why we care about that and how it influences pressure and how pressure influences what happens in our body and the maintenance of homeostasis. And so it's been really nice because it's divided into 2 weeks. Not a whole lot of material this week. You don't even have a quiz for that matter. So we'll just do a brief summary of some of those points that students have a tendency to have a little bit harder time with the next exam. Not to bring that up. I mean, we've just been 6 minutes past the due date of the previous exam, but appreciative that we have a little extra time for you to catch up, for you to also spend if you're in lab studying for the lab exam. So there's some advantages for this week all around. So let's go ahead and get started. Yeah, and let's see. There's not going to be a whole lot of gut diagrams tonight because, like I said, it's pretty straightforward, and I don't know that you people would have that many questions. This is, I think, the first one I wanted to show. This is, let me find it. This is on page 714, and it is figure 21.6. And essentially, you're going to learn about, in this chapter, about the differences between arteries and veins. Not just functional, but anatomical differences. You do need to know that for the course itself. In the lab, they learn all the names of the arteries and all the major arteries and veins anyway. And they do a little bit of this type of layers of the vessel walls, but not a whole lot. And so we want to make sure that that's touched on here. Now there's 3 tunicas, 3 layers that we see. You'll notice that they've divided the arteries into elastic and muscular arteries. So just pay attention to that and notice, and we'll talk more about this when we talk about the differences, but just be aware that these tunicas, these different layers, are very distinct in arteries. You can usually tell the adventitia versus the media versus the intima. It's very clear in a cross-section in an actual photograph to be able to see them. In the veins, not so much. They're a little more diffuse. It's a little harder, even though the picture diagram here shows it fairly clearly. When you look at a cross-section histological slide, it's a little bit more problematic to try to see that. In fact, I don't know if I have it. Let me see if I do. Your book has a great picture on 21.5 on page 713 that shows the differences between, I do have it, shows the differences really. So as you can see here in the artery, very clear distinction. Histologically, you can tell the difference between this tissue, and then of course this tissue looks different. Over here, like I said, a little more diffuse in the vein, a little bit harder to say, okay, I think this is where it stops, this is where it starts, and this one's even harder to kind of see the tunica intima here. And that's one of the differences anatomically that we see between arteries and veins, is that distinction of the tunicas are different layers of the muscle. So, pay a little bit of attention to the different types of layers and what they are. I mean, it's pretty straightforward. You've got an endothelium layer, you've got a smooth muscle layer, and then you have, connective tissue layer type of thing. But do spend some time looking at those and making sure you understand the comparison. Okay. Another important point about that, let's see, is this is Throwback Tuesday. Let me just show you something funny. Actually, I think. I don't know how clear it will show up on the screen. It shows up pretty clear on mine, but I've learned your view and my view aren't exactly the same all the time. These are my notes from way back in the day when I took 264 and 265. And boom. Okay. So back in my day, what I did is I took notes and then I typed them on my I almost said computer, typed them on my typewriter, and then drew the pictures out. Not a great artist, but it was trying just to give you an idea that there's these differences, and I thought we'd go through this, and then your book kind of puts them in different figures and different pictures. So, welcome, to, I don't even want to say the year. It was a long time ago, though. So, arteries and veins have, as you can see, differences. One, we talked about this already, the membranes are distinct versus diffused. In an artery here, like my picture, in an artery here, the blood cells are scattered throughout, and that has to do with the fact that you have this nice circular or cylindrical tube, so to speak, and so they are there. Where the vein is actually, there's a lot of folds because it's very elastic, and we'll talk about compliance and elasticity in a little bit, but you'll see that blood cells get trapped, and actually the veins are a good place to store blood reserves if necessary. I mean, the liver's another great place. 25% of our cardiac output at any given time is in the liver, but the venous system is also another place for blood storage. Once again, we see well-defined media, smooth muscle, elastic. There's no nerves in the artery. In the veins, it's thin, it's not really prominent, but there are some veins located or some nerves, excuse me, located in the veins. Medium artery. Arteries don't have valves. We'll talk about valves in a minute. Veins do have valves. They help with prevent backflow, just like they do in the heart, so that we can propel the blood forward. Now, this is an important point here. Half of the amount of arteries. So if we look at medium arteries versus medium veins, we have twice as many veins as we do arteries in the same size class. And you kind of see that right at the beginning of the heart. You have one aorta, but you have two pulmonary, or not pulmonary, two systemic veins coming in to the heart. One artery going out of the heart for, what you're literally looking at. The pulmonary system is a trunk. Both there, it kind of comes out one and then splits and then comes back as two as well. But you'll also see that I've drawn a medium vein, very, like I said, folded, and that's not really in here. That was kind of trying to be here, but that's, a good difference also. Let's see, the other thing you need to know. Large veins have less valves, if any. It's not as prominent. A large vein looks closer to an artery in that sense. A small vein will have lots of valves because of the pressure difference. So a large vein looks like a medium artery, okay, as far as size and as far as characteristics. And then you can see this is what the valves kind of look like. All right, so anyway, old notes. But then we're going to come to some of the actual current figures to kind of see this again. One of the things that is touched upon when, let's see, where is it? Here we go, is the way the blood flows through. So in an artery, blood is very laminar. In other words, it's a nice smooth vessel. Like I said, it's like a long cylinder tube. And so it flows fastest in the middle, and as it gets closer to the sides, it meets a little resistance, a little opposition to flow, and so it slows down, but it's still very laminar. In veins, the flow is considered very turbulent because it's not this nice cylindrical tube. It has those folds in it, and it has blood cells and other things kind of trapped in some of those folds. We have a very turbulent flow where sometimes the blood flows back, and you can see we have what we call eddies. Just like a river would have, some eddies and some swirls here. The same thing happens in our venous system. And so the flow also is different in veins versus arteries. And so arteries, once again, very laminar flow, very quick flow, but a very smooth type of flow. Where here it's very turbulent and has these little swirls and eddies. You can think of it as a river, a small river with a big rock bed. and how the water just kind of moves around. It doesn't actually flow. It still flows, but not as smoothly or as nicely. Another difference, which we'll be talking more about, especially next week, is the pressure inside arteries versus veins. Our pressure inside the artery is much higher. You kind of saw that a little bit when we talked about systemic versus pulmonary circulation. The systemic circulation has a much higher pressure overall because you have to get the blood through the whole body. Arteries kind of carry that pressure down. It does minimize as we get farther, and I'll explain that in a few minutes. But the pressure here is very high. Pressure in the venous system is very low. Actually, there's no pressure. So we don't see any pressure there, and we have some good diagrams for that. That, by the way, I'll probably tell you if I can find it. There's all this anatomy in here, so it makes it a little bit harder. Let's see. Well, maybe way back here. So that was on figure 2131 on page 741. And then here's just a diagram of what the drawing valves look like. I think I did a pretty good job, but anyway, here is showing the valves, the direction of blood flow. Once again, the valves will close in order to prevent backflow. Now, there's been a lot of questions concerning blood flow in the venous system and how we increase that flow and how we increase that pressure. It's not the autonomic nervous system like we see in the arterial system. We know that the sympathetic nervous system can stimulate blood vessels, smooth muscles to contract, and then so they constrict and they increase pressure and flow. That doesn't really happen. In the venous system, we have valves to help prevent backflow. We have skeletal muscles actually in your legs as they contract will compress veins also and help push the blood flow towards the heart. But you don't see, like I said, autonomic nervous system or nervous system in general stimulation to increase that. It all happens on the arterial side. And as more blood flows through here and as the valves close, like I said, or skeletal muscles compressing your lower limb veins are ways that we can increase pressure in our venous system, but it doesn't happen like we think of it in the arterial system. Okay. And once again, let me just define for those of you that didn't listen last week or weren't available to listen. An artery is any vessel that leaves the heart. A vein is any vessel that comes toward the heart. Veins can be oxygenated in the pulmonary system, they are, and arteries can be deoxygenated, once again, in the pulmonary system. They're not. And so make sure you understand that definition, especially when it comes time to test. That's always a really great testing point to see if you are listening, if you understand that type of thing. And so make sure that you know the difference between an artery and a vein. Here is just a really large picture. This is one of the first pictures. I should have started with this one, I suppose, instead of that picture. This is a fundamental figure. It's considered the histology of a blood vessel on figure 21.4 on page 712. You do need to know, like I mentioned, the sections of each tunica and what it's comprised of and that type of thing, even though this is the course and not the lab. So just make sure you do pay attention to that. All right, so let's talk a little bit more about blood flow. And whenever I say thermodynamics, well, fluid dynamics or physics, students don't really like that. A lot of students don't really like that. But it's really not so bad. And I'm trying to find, okay, is this it? That's pressure. Let me see if this is my peripheral resistance. Okay, well, this gives you an idea of pressure. And I just wanted to start with this because when we talk about blood flow and start talking about equations, we're going to talk about pressure differences. So we have a pulse pressure, which is the difference between the highest pressure during contraction and the lowest pressure during relaxation, and that's their pulse pressure. Now, when we translate this in clinical aspects, we're talking about blood pressure in the vessels, we refer to it as blood pressure. So the pressure the blood exerts on the sides of the walls of the vessels. Systole, as you learned for those of you in lab last week, systole is the period of contraction. Diastole is the period of relaxation. And you learned that in cardiac cycle too, but you had specific questions in lab about it. So a systolic pressure, once again, is that highest pressure that is exerted during that ejection of blood from the heart into the blood vessels. And remember that when we do the blood pressure on our upper arm, we are extrapolating what that pressure is likely at the aorta. Once again, the pulmonary circulation does not have much pressure, so we don't really pay attention to it. We don't talk about it. As you can see, we're specifically talking about the aorta and the systemic circulation. And then we have, once again, a pulse pressure, the difference between the two, and the mean blood pressure of what you're seeing, on average. All right. You will note that as we go down, arteries get smaller and arterioles get even smaller. We see a lower pulse pressure. The difference between the two is less, and overall the blood pressure decreases to the point of the capillary where there's very little pressure. There's enough pressure to be able to push those red cells through and give them enough time to have oxygen nutrient exchange as well as waste exchange. And then in the venous system, the venules, the veins, and even the large vena cava, the superior and inferior vena cava, the pressure is very, very low. So keep that in mind, because we're going to, like I said, talk about flow and why we see a difference in flow and in how we can figure that out. Now, the other thing that we briefly talked about last time was cardiac output. Cardiac output is a measurement of how many liters per minute your heart puts out. You do need to know that equation really well, like as well as you know the bicarbonate buffer equation, which you should know as well as you know your name. So please, if you haven't had a chance yet, please make sure you take the chance or time to learn the cardiac output equation, which is the heart rate times the stroke volume. A stroke volume is in milliliters per minute. Heart rate is in beats per minute or contractions per minute. And ultimately, we express it in liters per minute. All right, so here's another one that talks about flow that I wanted to mention, and that is that we see the velocity of flow. It's going to be higher velocity as we push it through the aorta. As we get towards the arterioles and the capillaries, our velocity, our speed of flow diminishes. Part of this happens to be due to a decrease in diameter, which we're going to get to today. Another part of it happens to do with the fact that we have now spread from one vessel, one artery, to several, to hundreds of hundreds, probably by the time we hit capillaries. And then we see that the flow then picks back up as we get closer, thanks to valves and thanks to skeletal muscle compression. As we get closer to the heart, our velocity of blood picks up. Okay, so a little bit more about blood flow. All right, so let's look at the equation. Poiseuille's law, or Poiseuille's law, some people say it that way. This may take a little while to come up to because it's scanned from the, where is it? Sorry, I'm looking. And, okay. Well, I have Laplace's law, and I have flow. Is this flow? Okay. This is going to look really scary, but we're going to kind of break it down. Oh, and it's fuzzy too. I'm sorry about that. So, Poiseuille's law is this, that the flow of blood is the difference in pressure over the resistance to flow. Okay? Sorry, I don't remember it being that fuzzy last semester. So, blood flow then is dependent upon pressure and resistance. Now, this is Poiseuille's law, this thing with pi in it, and the difference in pressure and the diameter and the 128 and the viscosity and the length. So what we've done is substitute what resistance is. Now resistance, stop sharing, resistance is equal to a constant times viscosity times the length, And in our case with vessels, we consider the length a constant. You know, there's not a difference. I'm trying to see if I have a little bit better picture of that. I don't. All right, well, we'll leave you blank for a little while. Anyway, over pi and the diameter to the fourth power. And the diameter to the fourth power is in the denominator, which means that ultimately what Poiseuille's law is trying to tell us is that little changes in diameter make big changes in resistance. So let me get the whiteboard out. Maybe that will help. Let's see, share whiteboard. All right. We'll see how well I marker this today. Let's get some black out. So resistance, I tried using my tablet and it was just as bad as using the whiteboard and it took longer. So that's why I still use this. So I apologize for how messy this is, but like I said, my tablet wasn't really much better and it was slower. Okay, over pi, which is a constant, as you know, diameter to the fourth. Okay, so this is what resistance is. And when we have a resistance, which by definition, the resistance is the force opposing flow. So if you can think of what doesn't allow something to flow through. If we're thinking water, like a garden hose, what doesn't allow that water to go through the garden hose? Well, part of it depends on the length. Part of it depends on the, let me get my highlighter out. Part of it depends on the length, which we don't have to worry about here. Part of it depends on the viscosity. Water through the garden hose versus, you know, molasses through the garden hose would be really different. And part of it depends on how big your garden hose is, cross section. Just as a reminder, back to my marker, or maybe pencil. Okay. Oh, that's very light. The diameter is this value right there. So, well, you know, in a perfect circle, it would be the diameter. Sorry about that. But all right, so if we have, say, this diameter equals 2. 2 to the fourth is 16. Sorry, I had to times it out in my head. All right, say we get a smaller vessel where x is equal to 1, then the diameter to the fourth is still equal to 1. So if you're dividing, say, this constant, this number, so you just have a number, let's just call it 400. So 400 divided by pi divided by 6 times 16, so 16 pi over 400 divided by pi. You can see that this small change here in diameter from a 2 millimeter to a 1 millimeter increases resistance dramatically, because you don't have that 16 in the denominator. The 400 divided by 16, as you know, is going to be 3 to 20 something. This stays 400 divided by pi. Oh, does that make sense? It is one of those things. It's kind of hard to explain without going through several problems, but it's small changes in diameter here, even if it's millimeters, will have really large changes in resistance. The smaller the vessel, the higher the resistance. And that's something else you should pay attention or remember, is that the smaller the diameter, the higher the resistance. And then when we go back to Poiseuille's law, which once again, you can see that the higher the resistance number, the lower the flow is going to be. So this is, if this is divided by 4, it's going to be much lower flow than if it's divided by 2. So if the resistance is small, then the flow is going to be faster. And that's what all this mumbo jumbo, all this math is really trying to tell us, is that that diameter is a big factor in how well the blood's going to flow. Now, students then ask, and I don't know that this is, we have a thing about this. Let me just see. I don't think we do. Peripheral resistance, I don't see it. Okay, so peripheral resistance is our overall resistance. Now, peripheral resistance in our aorta is going to be really high because we only have one aorta, and so it's really high. Now we know that an arteriole has a much smaller diameter than an artery, and because of that, you would think the resistance would be much greater, and in fact, it is for our singular. So here's the aorta, huge, right? Low resistance, high flow. And then we have an arteriole, much smaller, so greater resistance, lower flow. But our peripheral resistance is actually overall is lower in arterioles because what we see is we have one aorta, but we may have 100 arterioles for that aorta. We probably have more, but the idea is you have so many, the blood's split now 100 ways instead of one way, that the amount that's coming through here doesn't really compare to the amount coming through here. Oops. You probably can't see my arrow. The amount, oops, oh, that's not happy, is it? Hang on. Oh, there we go. The amount, oh dear, sorry. This thing just, sometimes it helps me, sometimes it doesn't. The amount of blood in this vessel is far less than the amount in this vessel. So overall, PR stands for peripheral resistance. Overall peripheral resistance is still lower in arterioles, even though individual resistance is much higher. Okay, and that's something else you need to make sure you understand the difference of, because you're going to see that in your exam questions. Maybe I won't say try to trick you, but try to make sure you really keep overall resistance, which we refer to as peripheral resistance, different than individual resistance of the vessels. Okay. All right. So that is one. We have a couple of them in this section. Another one is Laplace's law, and I do have probably a very poor document of that too. These come from McGraw-Hill, and for some reason the actual equations came back, like I said, ooh, really not pretty. Okay, Laplace's law is expressed by force, that's an F, equals diameter times pressure. So what this is trying to tell us is essentially is that if you change the diameter, you're going to change the force. If you change the pressure, you're going to change the force. So it's just a direct relationship, vessel diameter and pressure. And we use Laplace's law to try to understand how, when we don't have blood supply, what happens with flow. Why don't we get flow in certain places? For instance, when you are hypothermic and your body's shutting down and your tissue starts to get blue in your fingertips first, and in your toes and your extremities, why that's happening, because you're getting a decrease diameter, you're going to get a decreased flow type of thing, and it shuts off actually to help keep your core. That's not really the point, but this helps us with understanding pressure and how pressure changes, as well as how force is affected by that pressure change and the diameter change. Okay. So even if the pressure is the same, if you change the diameter, you change the force. And so just kind of know that. In fact, your book mentions aneurysm. I just want to really quickly, you do need to know the difference between an embolism, which is a floating blood clot, and an aneurysm, which is a weakening in the vessel wall. That weakening then can cause blood to pool in an artery and bulge, and that is an aneurysm. And if the aneurysm breaks, it can actually lead to death quite easily, especially if it's in the aorta or in the brain, because of the large amount of blood that can be released at that point with a greater force. Okay, so know the difference between embolism and aneurysm, and know Laplace's law, and the difference between that and Poiseuille's law. Finally, as far as equations go, I hope I haven't put you to sleep yet, but is the compliance. And compliance is the ability for the volume to stretch the vessel. So I'm going to have to rescan these because these look awful. Compliance is increase in volume over increase in pressure. So what this is telling us is if it's a vessel that does not have compliance, when we increase the volume, the pressure increases dramatically. A vessel that has a larger compliance or is very compliant, what will happen is you see the pressure only increases a small amount, but then you get a large amount increase in volume. The idea of thinking, I like to think of compliance in the sense of blood vessels is if a vessel is compliant, it's more likely to stretch with the extra volume rather than just increase the pressure. Okay? If it's something that's very rigid, say like a vessel that is stiffened due to arteriosclerosis, what you're going to see is a very non-compliant vessel. It can't increase volume as the pressure increases. It just gets higher pressure, and which leads to higher, systolic blood pressure and other problems, of course. So know the section on compliance, and let's just get rid of these ugly things. I'm going to just delete them afterwards. All right, so you should know those three. Poncelli's law, Laplace's law, the compliance. You should know and understand at least what those equations are trying to help explain. So, for example, you don't have to know the whole 128 times viscosity times length over pi times diameter to the fourth. For resistance, you don't need to know that, but you do need to know what that law is telling us. As far as small changes in diameter can make great changes in resistance, and in doing so, that affects flow. Also, that flow is or forces affected by diameter and pressure, and that ultimately, the last one with Laplace's law is that that diameter and pressure, the compliance, sorry, the last one is compliance, and that is that compliance, a more compliant vessel, for example, veins are several times more compliant than arteries, and that's partly because they have those folds. They can actually stretch and increase the volume when the pressure is increased. And so just know that that's why partly they're such good reservoirs. Anyway, so there is an example on table 21.13 on page 743 that just gives you the percentage of blood volume in the systemic circulation, as well as the pulmonary, it looks like, circulation. But you can see the large bulk of the blood in general is in the veins at any given time when you're looking at the actual vessels and not the organs and where blood is stored. All right. That's about it for tonight's portion, because tomorrow, or next week rather, we talk more about capillary exchange, net filtration pressures, net hydrostatic pressures, things like that. Let's see if there's anything else. So we will talk more about control of blood flow and how we do that. We've talked about the difference between functional characteristics of veins and how that affects the differences. Let's see. Capillary exchange. Okay. So, your reading guide actually says the following. The memorizing the formula is unnecessary, nor will be necessary to solve mathematical problems. However, you should be able to say what effects the variables have on blood pressure. And that is true. There's lots of questions about blood pressure and compliance and force and what does resistance mean. And once again, that's the force that opposes flow. And we can change that in all sorts of ways, whether that's through autonomic nervous system control or whether that's through our diet, and exercise actually can influence that, and of course just minor changes. Once again, you should know the cardiac output equation equals stroke volume times heart rate, and how that then is affected. How is stroke volume affected, and how is heart rate affected by the change in flow and the change in pressure in those. So let's see. I think that about does it. Does anyone have any questions? Okay, Jane, do you have any questions? If you get a chance, because this is a free week, good, I'm glad. Do spend some time. We are going back to hormones next week also. We talk about essentially blood pressure, and then, as you know, water balance has to do, most of our water, a lot of our water anyway, is stored in the blood. So we will be talking about regulation of blood pressure, and part of that has to do with hormones. We'll be talking about ADH, renin-angiotensin, and aldosterone, and ANH as well. We see these again in the urinary system, but we are going to hit it hard next week as far as making sure you understand those different hormones. So if you have a chance, for those of you that are listening later, because you don't have a quiz this week, take the extra time that you would normally be quizzing yourself and work ahead a little bit, because those hormones sometimes catch people off guard because it's a little bit of a complex system. And the hydrostatic pressures and the osmotic pressures, net osmotic pressures, also take people a little bit. It's a little bit harder or a little bit longer to learn. I'm looking for the page to reference that for you, and I just passed it. So hang on. Maybe. So I'm referring to figure 2136 on page 747. So take some time to learn that. That's an important aspect of questions on your quiz next week. I would pay attention to table 2115 on page 750, and then of course the hormones. And then you are supposed to read the circulatory shock, the clinical impact, on page 6 or on page 763. And it's becoming, until I experienced it myself, did not realize how much shock and the different types of shock that we have can be, that happen, I guess. And we believe the percentages of people who end up in some form of shock or in the hospital and then have some form of sepsis because they're in the hospital. And so anyway, it's an interesting little clinical impact, and there are some questions, because it's on your reading guide. There are some questions on the exam about it. Okay. Yeah. All right. Well, thank you once again for coming. I appreciate it. Have a great night. If you don't have any other questions, I'm going to go ahead and stop the recording. Yep.